Endoscopic submucosal dissection with additional radiotherapy in the treatment of T1a esophageal squamous cell cancer, randomized controlled trial. Introduction. Esophageal cancer is one of the most prevalent cancers worldwide. Emerging endoscopic therapies have been gradually replacing surgery for the treatment of early-stage cancer. The definition of early esophageal cancer varies among articles, but it is currently accepted as intramucosal carcinoma, T1a, regardless of nodal metastasis, which is further divided into subclassifications based on the depth of invasion: epithelial layer, T1a EP, proper mucosal layer, T1a LPM, and muscularis mucosa, T1a MM. Endoscopic submucosal dissection, ESD, is associated with a long-term survival equivalent to that surgery. However, ESD is not a cure-all, and recurrences are sometimes inevitable in patients with early esophageal squamous cell carcinoma, ESCC. Published data show that the 3-year recurrence-free survival, RFS, rate of T1 ESCC with ESD monotherapy ranges from 57.8% to 91.5%. Therefore, additional therapy after ESD is administered to control recurrence. Radiotherapy is recommended for treatment of patients with ESCC, T1a EP, LPM, or MM, as per the 2018 Esophageal Cancer Practice Guidelines by the Japan Esophageal Society, JES. However, high-quality studies investigating the efficacy of radiotherapy in controlling recurrence of early ESCC are lacking. To date, published literature has reported that 3-year RFS rates in the ESD plus radiotherapy groups range from 69% to 100%, and that 3-year cancer-specific survival, CSS, rates range from 82.1% to 100%, significantly higher than that seen in the ESD monotherapy groups. However, all of these studies were retrospective in design and included patients with T1a MM and T1b ESCC. Furthermore, all the papers reported the efficacy of ESD plus radiotherapy with concurrent chemotherapy, except for one published in 2018, which evaluated the efficacy of only ESD plus radiotherapy. Zhang et al. Designed a prospective randomized controlled trial to validate the efficacy of ESD plus radiotherapy in recurrence control and survival for early ESCC, T1a EP, LPM, or MM. In addition, the authors analyzed the risk factors for recurrence and procedure-related complications. Background. Endoscopic submucosal dissection, ESD, is effective for treating T1a early esophageal squamous cell carcinoma, ESCC. However, occasional recurrences are inevitable. This trial was designed to clarify the efficacy of combining ESD with additional radiotherapy in the treatment of T1a ESCC. Methods. Between January 2015 and September 2018, patients with early ESCC, T1a N0M0, following ESD were randomly assigned, 1-to-1, to the radiotherapy group or non-radiotherapy group. Patients in the radiotherapy group received a median radiation dose of 59.4 Gray within 2 months after ESD. In the non-radiotherapy group, patients underwent regular follow-up only. Recurrence-free survival, cancer-specific survival, overall survival, and complications were evaluated. Results. 70 patients completed the per-protocol treatment. 3 patients in the non-radiotherapy group experienced intraluminal mucosal recurrence compared with none in the radiotherapy group. No local lymph node or distant metastases occurred in either group. The 3-year cumulative recurrence-free survival was 100% in the radiotherapy group and 85.3% in the non-radiotherapy group. P equals 0.04, hazard ratio 0.08, 95% confidence interval, CI, 0.01 to 0.86. However, there was no significant difference in RFS between the treatments within the T1a invasion subgroups, P greater than 0.05. No patient died in either group. Mucosal defects of more than 3/4 of the esophageal circumference were positively correlated with stenosis, P less than 0.01, odds ratio 23.26, 95% CI 4.04 to 133.86. No severe radiation toxicities were recorded. Conclusion: radiotherapy after ESD might be a safe and effective optional therapeutic strategy to prevent recurrence of T1a ESCC.